Okay, a pleasant welcome to today's edition of our health talk. Today going to be an interesting show, an interactive one, uh, and we're going to be paying host to one of the most respected medical professionals. She's already in. She's in the background. She'll be joining us any moment from now. So let me quickly make this brief introduction before she can, you know, jump in so that we can continue this conversation. That's going to run up to 30 minutes. We're going to have her here for up to 30 minutes, and she's going to be giving us a lot of educative information that we can count on, that we can live by to be healthy. And she's a woman whose work is helping shape the future of healthcare in our country. And she's the president for the Liberia Medical and Dental Association. She is Liberia leading medical oncologist, head of the oncology unit in JFK. And she's the president for the Liberia Medical and Dental Council. So, ladies and gentlemen, to all of our viewers, those of us that have been waiting for this moment to interact with Dr. Dete Superwood, she's here and she going to be available for questions. And we're going to ask her all of the relevant questions and she's going to answer it. I trust her for that one. Yeah, I trust her for that one. So let me bring her on. Oh, I do that.
Good afternoon. How are you?
I'm okay. And how are you too? She's trying to get on. I think we lost her again. Yeah. So she's gonna fill her in with a lot of interesting information as it relates to the entire medical field, and especially as it comes to our doctors' well-being. And she will also give us some information when it comes to cancer because she's back on the.
Hello?
Okay, that I would say.
Yes, I think so.
Okay. So that means you don't go again at EDC.
No, then I edit you. My hand touched something by mistake.
Oh,
Not used to your StreamYard stuff, yeah.
oh, okay. Okay, no,
Mm-hmm.
but you have to try to get used to it because we're going to be
Uh,
inviting you most often.
yeah, I will try.
So, okay, Dada, welcome to Health Talk.
Thank you. Thank you.
And how you been doing?
Well, I'm okay. I'm tired, but I'm okay. Um, so yeah, we yeah.
Okay, so I just give a brief introduction about you. So, for those who may not know you beyond your professional titles, who is Dr. Dada Supo? Can't you just give us something that we can know who Dr. Supo is?
Well, beyond the professional title, Dr.
Mhm.
Teresu, it's just a young woman. She's a mother. Um, loves music. So she's also a member of the Monrovia Community Mass Choir. Um, considering I also love children. Also a member of the board of the kids education engagement project Liberia. It's a local NGO that um, works mainly with children and women, and we establish rooms all around Liberian government schools. So over the last 10 years, we've established over 25 mini libraries in all of the counties in Liberia.
Okay.
Dr. Tsubu is, like I said, she's a young woman who just loves to have fun and tries her best to balance work and life. That's it.
So with all of this, what inspired you to pursue medicine? What inspired you into the medical field? So maybe
Well,
Mhm.
I told this story to someone before, and I said that my mother, may her soul rest in peace, once upon a time mentioned that when I was much younger, I told her that I wanted to become a pastor. But when she told me, I was like, really? But anyway, I mean, I don't mean any disrespect to pastors, but anyway, so yeah, so my mom said that when I was much smaller, I said I wanted to become a pastor, but since I've known myself and I've always understood things around me, I've always loved helping sick people. So I always wanted to be a doctor because I grew up as someone who always loved to help sick people. So that is
Mhm.
where the whole medical school thing came from. Even though the pastor part is still, you can question
I w-
most people.
I waiting
I will take it
I
back.
waiting to experience that moment with you where you'll be preaching.
Jesus. Let God
I've
help
seen
all
you
of
in the choir before, but I've not seen you preach. So I'm waiting
us.
for that moment.
My ministry, everybody. So everybody has a different ministry. Everybody can be pastor in the church, right? So
Hmm.
I don't think I'm cut off to be a pastor, but I believe that I am in the ministry of healing, and that is where my work come in. I believe that the work I do is a ministry because we care for sick. I care for sick people along with my team. So, like I always
Okay.
tell my team, I believe that our ministry that we work in as Christians and as, oh, let's just say, as believers or religious people is to deal with sick people and take care of them. So that alone by itself, I feel, is a ministry. So I
Okay.
think that my ministry on that side, let the preaching part for another
Okay.
day.
So that's inspiring in a way. Was oncologist or become a cancer doctor was a part of that specialty, or did life lead you in that direction?
Life led me to it. I wanted to be a heart doctor at first, cardiologist.
Cardiology. Okay.
Then I started developing interest in the brain neurology. But then my
What did you
interest,
think?
I tell you, medicine got no small thing. Medicine got no small thing. But yet, my interest in cancer came about from my mother's illness. By now it's no secret because I always talk about this, that my mother died from breast cancer. So February 4th this year made it um 18 years. No,
Wow.
17 years since my mother died from breast cancer, yes. And she died at the age of 48. So she got diagnosed at the age of 41 and she died at the age of 48. So yeah, watching her struggle with the disease, battling it, that was what piqued my interest. And then after we lost her in 2009, um, I said to myself, okay, if I do become a doctor,
Hmm.
because she died my last semester in college, university. So I said, if I do make it to become a doctor, I think I would want to go into the field of cancer to study it and be able to help sick people. Because at that time, we didn't have any cancer doctor in the country. So
Hmm.
yeah, that is where the oncology part came about from.
That's inspiring. So, now let's come to business. Many Liberians know you today as president of the Liberian Medical and Dental Association. So let's talk
Yeah.
about your leadership journey. Now, before becoming president, you were known as a strong advocate for doctors and professional standards. I've followed you and I've watched many occasions where you took upon yourself, you spoke on these malpractices in the medical field. So what are the biggest challenges doctor face today that you can say out?
Well, there are a lot of challenges that we face. But the main issue is the availability of equipment.
Mhm,
It's it's one thing to know what to do, and it's another
mhm,
thing having what you need available to work.
mhm,
Yes. So the major challenge that we face as doctors is um, availability of medications and equipment, medical equipment, and to be able to work. Now, I must commend the Minister of Health, Honorable Louis Maplepoto, and also the CEO of GFK, Dr. Lena Birch. And I can even commend Dr. Alberto Clark from the 14 Military Hospital. All of these women are women who are leading these institutions, and they have been working tirelessly to see how best they can improve the health sector. Now, are we where we want to be? The answer is no.
no.
But are we where we used to be? And the answer is definitely no as well. So, in as much as we don't have everything that we need available, at least we are taking steps in the right direction. Take for example the issue of availability of medications in the various government facilities. Since Minister Poto took over, she one of the first things that she targeted was making sure that we have medications available in all of the government facilities. So now it's not very often that you will hear people complain about medications running out of stock in government hospitals, not just in Monserrate, but also, outside of Monserrate as well. So yeah, the major thing that we face is having what we need to work. Of course, I'm not going to talk about the money aspect because we never get paid enough. So and I guess some of my colleagues will say why I'm not talking about it, but um I would just say that yes, we never get paid enough, but we also working on that as well. And so yeah, let's stick to the medical part and leave the
So even for the
financial
board of
part,
hold you in
because
contempt.
I beg you, please.
So as
I
president
am
of
at a very
LMD,
difficult position, so I have to be very careful.
so I'm gonna get you. I know I'm gonna get you. Yeah. So as president of LMDA, what is your
Mhm.
vision for the medical profession and healthcare system in Liberia? Since you are leading a lot of professional people. Well, what are your visions?
My vision for medical doctors in Liberia is financial security. To be
Mhm,
financially secure. Now, it might not just be about the salaries, because if you just depend on salaries, the money will never be enough.
mhm,
But when you have other incentives available, when you have access to car loans, when you have access to bank loans that you can take, when you have good insurance that you can make use of, whether it's for health or life insurance, I want my doctors to have financial security in a sense. I also want them to be able to work in a safe and equipped environment. Yes, to be able to work in a safe and equipped environment. So those are some of the things that I've been targeting along with my other executives. So we've always been working along with the Ministry of Health and as well as GFK and other facilities to make sure that to ensure that our doctors are safe and they are taken care of. So it's a long road, and these things are not things that happen overnight. So the whole idea is about being patient and working along with people and setting realistic goals and achieving it one by one. So yeah, that's what we are,
okay, so
and
we're
we are
talking
keeping
about
track.
we're talking about professionalism and you being the president of the Liberia Medical and Dental Association of Liberia. So say we have witnessed over the time there have been malpractices and unprofessional doctors, unidentified doctors practicing, doing things
Point
that
of
are
correction,
not
these people have not been doctors. They have been quack doctors. People
quite.
impersonating doctors. They have not been doctors. So we have to make that clear.
Okay,
It's
so
not
so
doctors
so
who have
now.
been, there have been people who have been impersonating as doctors. So usually these things come about when you have someone who is a mid-level healthcare worker. Let's say, and
Mm-hmm,
I'm not saying that they are the ones doing it, but I'm saying, example, you could have someone who is a OR technician
mm-hmm,
or an OR nurse, and the OR is operating room, right? So you
mm-hmm,
maybe you have an operating room nurse, and an operating room nurse is someone is a nurse who works along with the doctors in the operating room. So you have someone, you could have someone who has been working in that field over the years, and they see the doctors doing the surgeries and they assume that they're able to do these surgeries too, because the thing that surgery is just cut and paste, that you can just watch someone cutting someone and joining or doing whatever that is done in the OR, and you think that you can do it. But the issue or the art of surgery goes beyond opening and cutting someone, just opening and cutting someone. So for example, you could have an OR nurse who has been practicing for a while now, impersonating at a local facility because they've seen someone, maybe they've seen doctors do appendectomy over the years, and they're like, oh, but I can do appendectomy. And then they go and decide to go and start doing appendectomy
mm-hmm.
at these local facilities. So these are not doctors. These are people impersonating to be doctors.
So how can ordinary Liberians identify qualified healthcare providers, identify doctors that are qualified?
Um, of the things that we are working on with with the Liberia Medical and Dental Council is to be able to publish the list of doctors
Mm-hmm,
that are licensed to practice in the country. Just as the lawyers can produce the list of, lawyers that are licensed to practice law in Liberia. The Liberia National Bar Association, they produce that list every year, right? You have the
mm-hmm.
Engineers Association of Liberia, they produce the list of qualified engineers every year as well. So we're working with the LMDC, which is the council, and there's a difference between the council and the association. I'm with the association, the council is different. So we're working, but they are like two sides of the same coin. I see you looking a little bit confused. The
Mm-hmm.
council is different from the association, but there are two sides of the same coin, and we work very closely together. The council is
So
headed by Dr. Ian Castell.
what's the difference? What's the difference? Can you just
The
provide that
difference
clarity?
is that the association, LMDA, focuses on the well-being and welfare of doctors and dentists operating in Liberia. We are an advocacy group.
Mm-hmm,
The council, on the other hand, is responsible for regulating medical practices in the country. So every healthcare worker, whether doctor, nurse, physician assistant, lab technician, everybody falls under the council. So when there's issue of medical malpractice, the council is the one that handles it because they are the ones who regulate medical practices, right? They monitor. So the council is the one that will go to health facilities and carry on inspection of facilities to make sure that they are up to standard and what have you.
mm-hmm.
Yes. So the council is different from the association. I'm with the association,
The association.
although I'm also a member of the council, but I'm more with the association. So there's a thin line between the two of them. Yes.
So tell us some of those changes since you took over that you have, you know, influence or you have made within the association.
Um, the first thing is that our association last year was struck by a scandal,
Mm-hmm,
and it really affected the public image of the association. Um,
mm-hmm,
it affected, let me say, the way people saw Liberian doctors. So one of the main target has been to rebrand the association, as in to regain our respect as an association, that when people, hear about the doctors association, they want to say, oh, la brand doctor, so Yes, that's one thing we've been really working to rebrand the association. I think we've been doing a good job so far. I'm not going to grade myself. I'm going to leave that to the public to decide. But yeah, I got to pat myself on the back more and say, yeah, I know that I've
But
been.
tell us, what are some of those rebranding things that you brought to the
So we
association,
we we
most of
we, we
as a
most
president?
times, yes. So we've made the association more visible. We've made the association more visible. As in, people um were not very familiar with the association. And that was really
Mhm.
evident when we met the president, Honorable His Excellency Honorable Joseph Nimapaka. We met him and he was like, "This is my first time meeting the association. I mean, I've never heard about the association before, and it's a good thing." So yes, we have decided to be more engaging. At first, we were told that, oh, doctors not supposed to be like, we were under the impression that doctors not supposed to be seen, in public, and people not supposed to really hear about us. We should just be in our little corner in the hospital wearing white coats and doing our work and minding our business. But we have been like, hey, no, we can be visible and in a positive way. So we have been working on becoming more visible. We have been engaging people more. Um, we also trying to reestablish our presence online by updating our websites that we have, and we've been doing some work on it, and we've also been doing some internal handling some internal issues within the association, amongst our members, and also regaining the trust of the membership as well, because there has been a lot of things that have been going on over the years. So there has been some in-house struggles that we've been trying to handle and manage, and trying to bring people together again and try to resolve issues and just rebranding from within and outside as well. So yes, we've been working on that. We've also continued the one of the major activities of the association, which has been the medical and surgical outreach that we do every quarter. So we continue that, and we've been trying to make sure that it's done on an even larger scale. We were in Lofa in the beginning of May. We spent 2 days carrying out free services for the people there, surgery as well as medical. And over 2 days, we saw about 655 patients over 2 days. So yes,
Okay.
there are a lot of work that has been going on in the background. There are a lot of coordinations and that have been going on in the background as well for the association. And we've been working along with the Minister of Health as well. She has also been very supportive, and yes, she's been really supportive. And she's also a past member of the president of the association too. So
Okay,
she
super.
understands what it means to be in this position. So she has really been supportive of this leadership. Yeah.
So, if I may ask, lastly for this your whole LMDA, if I may ask, many people think doctors only advocate for themselves when they speak out. They do protest when there are no fund. How do you respond to those who believe doctors' demands are not connected to better patient care?
I don't understand when you say not connected to better patient care. What do you mean?
So people think that doctors only advocate for themselves.
That's
So
not
you
true.
understand you understand my point, right?
That's not true. So the fact that we don't come up to talk about it does not mean we don't do it. But we're always working with administration of the various health facilities. For example, if for example you like, okay, like for example, let's take cancer. The cancer. Let's talk about the cancer care in Liberia.
Mhm,
Um,
mhm.
let's say like 3 years ago, we didn't have a facility available at JFK specifically for cancer patients to receive the treatment. Now, through my advocacy and instrument mentality, we have the oncology unit that is very functional, that is very, very active, that has been seeing taking care of cancer patients over the last 2 years. April made us 2 years since we opened, and it has been ongoing. You have improved surgical services going on at GFK. How do you think the services are coming about? It's because of the various doctors and specialists that are coming back and working along with administration to say, okay, now we have this pediatric doctor back. And so he goes to the administration and said, okay, doc, can we work on getting pediatric machines for the pediatric cases? Can we work on getting instruments for the so these are all improved health services, right? And how does it come about? The doctors are advocating, but we don't have to come and write it all on Facebook before you know we are advocating. When you
The
see
advocate behind
improved
the scene.
services, when you see improved services in the hospital, it's because the doctors have been working with administration to improve those services. So that is advocacy, right?
Mhm. So,
Okay, so
so,
we don't
so,
just talk about our salaries.
okay. So the people then should kind of be advocating behind the scene for them.
Oh,
There are a
of
lot of
course
work
we
going on
are.
behind the
We are.
scene.
When medications are not, when certain medications are not available in the hospital and we need it, and we go to the administration and say, administration, we have started to see this kind of patients and we need this kind of drugs for the patients. Can you make them available? That's advocacy. And the
Yeah.
administration, and we continuously engage the administration until the administration makes the medications available. That is advocacy, because at the end of the day, when those medications are available, then we are able to treat these patients more holistically, right? So that is
Yeah.
advocacy. So we don't
Okay.
have, like I said, we don't have to go on Facebook to write it off first before you know that we are advocating.
Okay. So now you just jump into your area or specialty. So tell us,
Mhm.
what exactly is this cancer, and why should Liberians be concerned about cancer?
Cancer, in a simple term, cancer, the Fakao cell, you know, the football fanatic, right? So when you say Fakao,
Mm-hmm.
Fakao, I can listen. I always like to use
Yes,
that.
okay.
I always like to use that term to describe cancer cells, because cancer cells are cells that are growing uncontrollably in the body. When the body says stop growing, the cancer still growing. It's not listening. So Fakao say again, listen, right? So yeah,
Mm-hmm.
cancer cells are Fakao cells that are growing out of control in the body. And it can happen anywhere. It can happen in the blood, in the bone, in the brain, the kidneys, the skin, anywhere cancer can happen. Now, why should we be concerned? We should be more concerned about cancer because we are having increased number of cases in Liberia. Why are we having increased number of cases? Well, I would like to think that our lifestyle has contributed significantly to the increase in cancer. Now you have more people drinking. A lot of people are smoking. People are not very healthy. They are not monitoring their diet. They are not watching their weight. When people getting fat in Liberia, they can say, "Oh, the person enjoying." They're not enjoying.
Mm-hmm.
Actually, that's not enjoyment. Oh, the person's stomach getting beef, and the person there, the bigger the stomach, the better. No, the bigger the stomach, the more problems you probably developing for yourself. So yes, we are not watching our diet. We don't really exercise. And the kind of food that we eat. A lot of people eat processed food now. A lot of people eat these junk food, sandwiches and what have you. So yeah, these are not healthy food. So our lifestyle, I would like to believe, has contributed significantly to the number of cases that we increase in the number of cases that we are seeing in
So,
Liberia.
what type of cancer case are you seeing mostly at your your unit? What are the common one that you see mostly at your unit?
Breast cancer, cervical cancer. I see a lot of liver cancer patients through my OPD. Those ones we put them on tablets and follow them up so they don't really come to the OPD. I also see quite a number of blood cancer patients as well. Sometimes bone cancers, but the two most common cancers that we really see in the unit, blood breast cancer number one, and then cervical cancer number two.
Hmm.
Yeah, but we do treat all types of adult cancers in the oncology unit medically.
So you treat all type of adult cancer here now.
Of course. So that means every time. So that means we do get to see other type of cancers. We do treat bone cancers. We do treat certain type of skin cancers, not certain type of skin cancers as they present. We do see kidney cancer patients. We do see, like I said, liver. We do see colon cancer, and any cancer, blood, whatever.
Okay. All right. So, folks, if you just joined us, this is Spoon. We are live here. This is Health Talk, and we are here with Dr. Dede Superwood. She's the president of the Labrador Medical and Dental Association, and she's also an oncologist. She's the head of the oncology unit at the JFK. We'll talk about cancer, right? Yeah, in general. So the phone lines are open. You can call and just during this conversation. You ask questions. You can call the number already on the screen is our WhatsApp number. You can call 0776 for only WhatsApp. And you can call us locally on 0555 to join the conversation. So Dad, before we take leave of you, because I know you kind of pressed with time. So tell us, what are those early warning signs people should never ignore when it comes to this kinds of thing?
First, I would say anything that grows on you, on your body that should not be there, that is removed and then it start growing again, you should
Hmm.
be concerned. Yes, you should be
Anything that
concerned.
growing your body, small nozzle on your body growing.
Listen, if you have a lump,
Mhm.
if you have a lump that is on that grows on you and it is removed, it is not so. If it doesn't belong there, it is removed. It's not supposed to come back. Okay, so if it comes back, you should be concerned. And if it comes back and it starts to grow again, you should be concerned. Hmm? So that lump means anywhere in the body, whether on your skin or in your breast or anything, anywhere a lump is on you and it is removed, then it comes back after a while, it should raise concerns. Because, like I said, if something comes on you that should not be there and it's removed, it should not come back. So if it comes back, that should really trigger your interest and trigger you to go and seek further care. Um, Cancer symptoms are usually really non-specific. They are really vague. So you cannot easily tell somebody if you have this symptom happening to you, that means that cancer, you should go seek care. You understand? But what I would say, a few things I would say, like if you are being constantly treated for infection, like if you're having vaginal discharges constantly, let's talk about the most common ones.
Mhm.
The most common cancers we deal in Liberia, cervical cancer, breast cancer, and what have you. If as a female you are repeatedly being treated for infection, for the vaginal there, and that infection not going away, please you need to go and get further test, go seek further testing. If you're having foul smelling vaginal discharges, brownish water or what have you coming from you, painful sex, those are all things that need to make you to go seek further care. Bleeding when you're not supposed to be bleeding, or if you're bleeding more than you should be bleeding, those are all things that could be pointing towards cervical cancer. Now, if you're talking about breast cancer, if you have lump in your breast, knot in your breast, you're not supposed to be there. I'm not saying every knot that in the breast is cancerous, because some knot can
Mhm.
be in the breast, can come in the breast, and it is not cancerous. Sometimes the knot can come in the breast is because of the state of the female body at the time during her menstrual cycle, but that is beside the point. But if you have a knot that is in the breast consistently and is increasing in size consistently, you need to get checked. Having abnormal discharges from the nipples, you not breastfeeding, but breast milk coming out of your breast every now and then, or blooded, blood coming from your nipples, those are all things that should make you seek care. Non-specific symptoms like you having constipation all the time, you constipated, you want to stool but you can't stool, you
Mhm.
really want to and you can't do, and it's going on for a while. Then after a while, then you notice that your stomach just break loose again. You start having running stomach, which we call diarrhea. So when you start having what we call alternating bowel symptoms, bowel habits, one time you constipated, at another time your stomach running, at another time you constipated. If it's happening to you constantly, you need to get tested. You need to go check. It could be a early symptom of colon cancer. Um, if you're going to always feeling sick and you go to hospital, they tell you say your blood low, they give you blood. You go again after 1 2 months again, you go by, you not feeling well again, tell you say your blood low, they give you blood. So if you're having repeated transfusions, blood transfusions, you need to get
Mm-hmm.
tested as well, because you could be, those could be symptoms of cancer of the blood. So there are very non cancer symptoms are usually non-specific, and that's one of the reasons why people tend to get diagnosed late in our society, because we don't practice the habit of going to check for regular checkup at the hospital. And even when we start getting sick, we always prefer to self-medicate than to go to the
Mm-hmm.
hospital to get
To go to
tested.
hospital, yeah.
Yes. So symptoms of cancer, they are very non-specific, but what I would say is anything that happening to you over a period of time, it just happening, you now treat it, and I'm will please go and go get tested or seek the doctor's advice on what to do next.
So, how accessible is the cancer treatment is right now in Liberia? Like in terms of the importance of screening patients or people observing unusual thing happening to that body. What the accessibility when it comes to that?
So it depends on what's happening to you.
Mhm.
It depends on what's happening to you. And um, I would not say it's readily accessible, because you have, for example, only one medical oncologist. One, how many patients can I see?
You're feeling one deal.
Don't laugh. I mean, right now I had to. I'm on leave. Right. I should have been gone for 1 month, but my team, oh, that you will go for whole 1 month. I said, okay, I will cut it down to 2 weeks. So I should have gone for 1 month, but I had to cut the leave down to 2 weeks. But let's
Hmm.
be real. How many patients can I want see? And
So how
people
many
get
patients you
and
you
people
you can
people
you
get
can you can take
upset.
a day?
People get upset. The hospital has schedule. So I run my clinic, my OPD, the clinic, where you say you're not feeling where you go to the hospital. So I run that twice a week at GFK. I'm there on Mondays and Thursdays. It has to be on appointment basis. So
Hmm.
on Monday, I see between 15 to 20 patients. They actually gave normal off for 15%, but by the time the next I saw me finish begging me and all that, so now we can push it to 20. Thursday, we gave numbers off for 10. So between 10 to 15 patients on Thursday. On average, I see 25 patients every week. That is constant. On average, I see 25 patients every week. And how many people might say, oh, it not sounding, they might think the number is small. But just think about having to have counseling session with every patient that's coming.
Hmm.
And you have to be very thorough, because as an oncologist, I have to be very thorough. I can just say, okay, the patient here, this, da, 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 and then, yes, go, and then that's it. So I run the OPD twice a week. The unit is open every day of the week from Monday to Friday. So whether I'm in OPD or not, I have to be following up on the patients that are in the that are coming for treatment in the unit every day. So when they done taking their treatment, when the team have finished their own work, they pass the charts over to me. Then I have to review all of those charts every day on my left. And then before we start talking about those who are admitted. So when you put everything together, I will just say to you that it's not readily accessible, because manpower is a very serious issue. But with what's available, we try our best to do what we can. But I'm human, so that ain't ready.
Imagine you're one. So what becomes of those that are far away from Morovia, and especially our people, most of them, they are afraid of going to the hospital. Some of them will just go to the drugstore when something happening to them. They will just get something and take. Some of them will just get random drugs and take it. So what become of them? Because you the only oncologist in Liberia. I'm quoting for you,
Medical
right?
oncologist, medical
Medical
oncologist.
oncologist. in Liberia. I'm quoting from you directly. Yeah.
Mhm.
So is there a way, or is there a policy or something that you're thinking about in decentralizing your unit, where people in the other parts of Liberia can get access to this care?
The
But
thing about
cancer is a
cancer,
very
the
serious.
thing about cancer treatment is that it's a specialized kind of treatment. Dana malaria medicine, for anybody you can check will take it and swallow it.
Mhm,
Mm-mm. Dana malaria medicine. So we're still working on the unit. It is not where we want it to be. So we're still
mhm,
working the unit. Right now, the unit is like getting small for the patient load. Right now, the unit is getting small for the patient load. So while we have what we have, we're trying to upgrade it, make sure things are available for the patients. But with time, we will need a bigger space. So the first thing that you can, the old people can say, you got to take out the bird out in your hand first, and before you start looking for the one out in the air, right?
mhm.
Mm-hmm. Yeah, so the bird are in our hand now, the unit that we have to maintain it. We're trying to upgrade it and make sure that it remains functional to be able to serve the Liberian people before we can start thinking about decentralizing, because it's not just about decentralizing. When you open oncology unit outside, who's going to man those facilities, those units? Do you have the human resource? Because like I said, cancer treatment has very specialized treatment, that's very specialized kind of drugs. So not anybody or everybody is supposed to just hang chemo or cancer medications up, because it's not just about just putting the medicine up. There are so many things, so many small details that you have to follow up with when you're treating these patients. So it's not just about hanging medicine up. So you can't talk about decentralizing now when you have not even centralized what you have yet.
Hmm.
So what
So,
we need to do is we need to work on the human resource first. We have two other colleagues that are outside training, and
okay.
they should be joining us. One should be supposed to be coming by the end of the year. The other one's supposed to be coming by next year. So we are hoping that we get more people on board and expand the services that's available right now gradually in Monrovia first. Then we can think about going outside of Monrovia.
Okay. So, one of my followers just asked a question, and she wants to know how important is the screening when it comes to the cancer, and where you people do your screening. Is it you people do outdoor screening, or is only at the facility?
So the screening is very important in cancer care, because what screening does is that it will catch um, early cases before the person starts to show symptoms, and that's screening. You're not having any symptoms, but you just decide to go check. That is screening. Like for example, the breast, and you always say, "Oh,
Mhm,
preaching mammogram." Or to welcome again, everybody will be all they be, "Oh, check your breast, check your breast, check your breast."
mhm,
So yes, the screening aspect is wherein the person is not having any symptoms, but you just want to go and check. So like I said, when we take for example the breast, right? You send someone to do a screening mammogram, a healthy woman, she's not having any symptoms, she's not having any lumps, no nipple retraction or nothing, but she just decides to go and check. And so that's screening. Now the purpose of that mammogram is that the mammogram is an x-ray machine that will pick the mammogram has the ability of picking up a mass that is as small as 0.5 centimeters, as small as 0.5, because when there's a lump in the breast, we don't really get to feel it until it's like around 2 centimeters. But
mhm.
if it's if a lump is as small as 0.5 centimeters, the mammogram can pick it up. So that's the purpose of screening, to be able to pick up early cases, because everywhere around the world, when it comes to cancer treatment, the earlier the diagnosis, the better the outcome. Now, where are our services available? Sometimes, and that's where other institutions come into play, like the Liberia Cancer Society, like Public Health Institute of Liberia, Institution of Liberia, PHRL. Is this lady, Kiri Kidibo, I just keep forgetting her Joyce Kidibo. Yeah, she's her program focuses on cervical cancer and breast cancer screening. Then there's the Glabra Cancer Resource Initiative, or CRI, that does the breast cancer work every October, but also they also encourage screening as well. So all of these institutions, and then like recently again the Liberia Cancer Society, they did a launch for prostate cancer screening. So there are different institutions that help that are helping with creating more awareness, public awareness, and conducting screening so that we can be able to catch cases early. Because unfortunately, most of the patients that come to the hospital, people, it's like JFK is always at the end of the line. So you know they don't go. By the time they reach into JFK, they already at a very late stage.
Mm, yeah.
Yeah, yeah. So the purpose of the screening is to be able to catch these patients before they even start to show symptoms. And that's the thing about cancer also. When someone has cancer, for the most part, they will not show any symptom. And that's why cancer is one of the silent killers, because the cancer will be there destroying you and you will not really be having symptoms. But then when you start to show symptoms now, then unfortunately, sometimes the cancer is more advanced. And most of our patients come very advanced. And our system is the way our system is set up right now. We need to be able to catch cases at an earlier stage when we can give them better fighting chance. So that's what it is. Screen when you don't even have symptoms to be able to catch cases early.
Okay. All right. So, well, we have taken almost all of your time. So let's try to leave it. So, despite all of these challenges, what gave you hope?
Um, when my patients tell me, "Let God bless you," it's
May
sounding
God bless
funny, eh?
you. After they have recovered.
Not when they have, not just when they have recovered.
Mm-hmm.
So, in my line of work that I do, I deal with very sick people. Mm?
Mm-hmm.
I deal with people who are very desolate, who are very heartbroken, because the diagnosis of cancer is something that is almost like a death sentence when people hear it. They, oh, soon you hear cancer, say, oh, you coming die. Hmm? So
Mm-hmm.
I'm dealing with a lot of people who are sick. I'm dealing with a lot of people who are depressed. A lot of these people come in with experiencing severe pain. So sometimes I have to even focus on relieving the pain first, or reducing the pain before we can even start paying attention to the cancer itself. So the fact that somebody can come to me in severe pain, or they can be having pain, or they could be having cancer, and they can receive treatment and they start to feel better, that is enough for me. And that, like I said, that let God bless you. Hmm? I don't take it
May God.
lightly.
Mm-hmm.
I never take it lightly. I never take it lightly, because another thing that people don't even realize is that most of these people don't even have, a lot of these people don't even have money. So that's why my team and I, we always out there looking for ways to look for ways to make medications available. Like today, the Minister of Health made a very huge donation to the oncology unit. I'm just from the ministry. Thank you so much, Madam Minister. I think if you check the Ministry of Health page by now, the post supposed to be up. She made a very huge donation of cancer drugs to
Oh,
JFK
wow.
Oncology. Very grateful for that. Yeah. So I mean, when people, every now and then somebody will come in my DM and say, "Oh, I have $200. Can I give it to the cancer unit?" I'm like, "Yes, please do." I have $50. Can I buy medicine for somebody? Yes, please do. So, all of these things, when we put them together and we give somebody who ain't able to buy the medicine, when you can provide care for that person without expecting anything back from them, and they can look at you and tell you, say, "Let God bless you." For me, that is sufficient, and that is enough reason to motivate me. The fact that I can help save someone's life, even if to work with them and to buy them another 3 or 4 months to spend with their family, even when they have an end stage disease. That is what keeps me going.
Do you have a pediatric center for? Do you have a pediatric center, especially for kids that have cancer?
We have pediatric oncologists. They handle their cases on their end at the pediatrics department.
Okay. Oh, so
Yeah.
your unit don't cover
It's
these
for
cases.
adults. We deal with the adults. Adults. Like I said, I'm a medical oncologist, so that means I deal with adult cancers only. To be honest, I ain't want to see children sick. Worse of all, to see them suffering from
You're crap.
cancer, I will cry. Yeah.
But
When
that
I
no.
be person,
That
when I when I be person, I can hold my heart.
mm-hmm.
And deal with it, but not when I have to deal with children. I can make it.
All right, Doc. So it's been a wonderful time with you here, and I think we need to take leave of you now, and so that you can pay attention to other things. So just a parting comment, something that Liberians can remember, just one health message from you today, that when they finish listening to the show, they'll say, yes, we got this message from Dr. Supu.
Well, I would just encourage people to live a healthy lifestyle. That is why we encourage people live a healthy lifestyle, because at the end of the day, it boils down to practicing a healthy life, living a healthy life. Yeah. Uh, Balance everything you do. Try to balance, maintain a balance, and please check the hospital regularly. We at the hospital, we are not your enemies. We are your friends. We are there for you. We are your very relatives as well. So
Mm-hmm.
you don't run away from oil. Please come. We That's why we chose that field, to come and to be there to help you people. So doctors are not your enemies. Liberian doctors are not your enemies. We are your friends. We are your families. We are your colleagues. So please feel free to come to us to the hospital when you need to seek care. And even when you
Some
don't
people,
and you just want to get checked, please come.
some people say some of your colleagues can talk to them harshly, so that the reason they stay in your way.
Well, and TD don't can for anymore. And sometimes when you chew, you can just boil your tongue for no reason. I will
Mm-hmm.
make you say you come in call your tongue for your more. So when you boil your tongue by mistake, you can get and go call your tongue for your more. TD don't can for boy stay there. So
Okay.
yes, sometimes doctors, sometimes healthcare workers may not have the right approach to patients, but we are a work in progress. So let the whole country, all of us retire. So you're just
Everybody,
there. Yeah, everybody tired.
everybody gets stressed one way or the other.
Some kind of way. But at the end of the day, all of us have to put our different stresses aside and work together for the improvement of our country. But Liberia is all we have, right?
Definitely.
So yeah, so you're sorry, I don't know my I won't be out for all
And
my talent.
before you go,
You
someone
know.
just asked if they want to do a donation, how can they do it?
Oh, well, you can get to Joris, Joris will get to me.
Yeah,
I'm forgive.
you need to.
No, but you can reach out to me. You can reach out to me.
Okay.
Send me
Yeah,
a
sure.
message on Messenger. Yeah. Even if I don't reply right away, when I see it later on, I'll reply. So yes, you can reach out to me, and then I can guide you through the process on how to go about it.
Okay. So you can reach out to me. I will connect you with her. Then you can start from there. Yeah. So we are all here helping to save life. So we have to play our own role too. So thank you, Dai. It was nice having you here,
You're welcome. I
and
told you
hoping
telling
to
me
see
so
you
staying
again.
up going for 1 hour.
Oh, they're going almost. Oh,
Anyway,
I
that's just
remember
all
the
good.
last time. I remember the last time you were here. I think 3 years ago.
I think so. Yeah, it's been a
Yeah,
while.
that time you were away. You're studying.
I was still a student. Yeah. No, yes, it's been more than 3 years, because I think it was 2022 that I came on the show. It's been about 4 years. Yeah.
For you've been a long time partner.
I tell you, now you won't persuade yourself from me by watching you.
No, we'll get part of wisdom, but we'll do together. All right, I
Yeah.
think it was nice having you. I
All right.
appreciate the time.
Okay, you're welcome.
Okay.
Bye.
All right, so folks, that was it there with Dr. Dede Support. She's the president for the Liberia Medical and Dental Association and also an oncologist, the only medical oncologist that we have in Liberia. So she was able to give some advices to us, and I hope we took in all of those advices. It's important that we check up on our health to know what's happening with us. It's very much important, especially for some of us that hate exercising, you know, some of us that hate going to the hospitals to do our regular checkup. Like what she said, cancer cases in Liberia is increasing. And imagine she have to cater to over 20 patients a day. Can you imagine? See the workload that is on her. And so what becomes of others that are in Lofa? What becomes of others that are in other parts of Liberia that can't get access to her? What become of these people? What become of these people? So we have to take our health very important. And today's discussions remind us that a stronger healthcare system requires collaboration among healthcare professionals, policymakers, and the public. We all need to work together for the betterment of our health system. Every one of us have part to play in making sure that we have a better health system. It's me, it's the health workers, it's the government. We all have a part to play in making sure that we have a better health system, because if anything happens, everybody will get affected. Everybody will get affected. Imagine she have to take all of these patients a day to talk to them. And, it's a very huge tax, a heavy load, but yes, she have to do it because she signed up for it. But even though she signed up for it, we too have to take every necessary precaution. We have to take every necessary precaution, take every preventive measures, understanding the fact that we have a lot of different outbreaks. And so we have to take these health uh, precautions. Listen to health workers, listen to the Ministry of Health, listen to NFIL as they provide these updates, this information that we have to follow to make sure that we get safe and healthy. So again, I've been here. I'm Jorais, the Israel Prince Joe. Thanks to all of you that have been following, and those of us who have sending our messages and comments, and those of us that were unable to call, to be part of this discussion. You can join us next Friday. We'll have someone here again sitting here to explain some health issues. Explain to us in details. Tell us what's happening, what can we do, how can we prevent ourselves from these health problems. They will be here. So we're going to make this show very interactive, very interesting, that it will address all of our concerns. So until next time, stay informed, stay healthy, and remember that your health is your greatest, 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 greatest